Moving on to the next session. The topic for this session is nutrition in patients with recurrent renal calculi. I am honored to invite the chairpersons for this session, Dr. Jyotsna Madam, Senior Consultant Nephrologist, Tar Hospital, Jubilee Hills, Hyderabad. Dr. Sridhar Reddy Sir, Senior Consultant Nephrologist and Transplant Physician, KIMS Hospital, Minister Road, Hyderabad. Dr. Deepthi Madam, Associate Professor, Department of Nephrology, ESIC Super Specialty Hospital, Hyderabad. Dr. Shrikant Sir, Senior Consultant Nephrologist, KIMS Hospital, High Tech City, Hyderabad. I would now like to invite the speaker for this session, Dr. Ravi Kushwaha Sir. I would request the chairperson to introduce the speaker.
Good afternoon. I am glad to introduce Dr. Ravi Kushwaha, Additional Professor in Department of Nephrology at SGPGI, Lucknow. And now he's going to talk about diet for prevention of recurrent renal stones. As we sit in Stone Belt, where Hyderabad is a part of Stone Belt, it's very important for us to understand and prevent recurrent renal stones. Now he's going to elaborate and talk about diet, how to prevent renal stones. Thank you.
Thank you, chairpersons. First of all, I thanks the organizing committee for inviting me to present this session. As we all know, the renal stone disease is a very common disorder. Mainly, its prevalence is very high in hot or warm climate areas, and especially according to the data, various studies, it is shown that there is approximately 12% patients are affected worldwide, and in India also it is in the same prevalence rate. However, it is more common in northern part of India. Also, it is also shown that this is an important cause of chronic kidney disease. It may affect the total chronic kidney disease population up to 13% in some studies. And recurrence of renal stone disease is very common. It may vary between 30 to 50% patients, and after 5 to 10 years. However, it may increase up to 75% after 20 years. Incidence of kidney stone disease on our rise because of the behavioral changes, lifestyle changes, and change in the dietary habits that contains low water intake along with the consumption of high salt and high animal protein. Pediatric populations are also not unusual to find the renal stone disease, because these populations are also affected by these behavioral changes, increasing the change in the diet intake with processed food. Before going to the interventions, dietary intervention, we should know the process of renal stone formation. There is 3 components. First component is the lithogenic component, and the promoters of stone formers and inhibitors are the stone formers. In the presence of promoters of stone formers, the calcium, sodium, uric acid, oxalate, terms for proteins, although it is known as inhibitors of the stone formation, however, the mutated forms or structurally abnormal protein may result to increase formation of stone. And low urine volume is also very important promoter for the stone formation. Inhibitors, these are organic, including the citrate, magnesium, term horse protein, as we discussed, osteopontin, nephrocalcinosin, and high volumes are the inhibitors of the stone formation. Our body try to maintain in balance between the promoters and inhibitors of stone formation. If there is an increase in the inhibitors, there is a less chance of stone formation, and promoters, if it is more, and there is increased chances of stone formation. But along with this, we have to know what the patient know, because the process of stone formation is not very relevant to the patient, but we have to explain, and the patient when asked about the what should I eat, how much I should eat, and how to avoid the recurrence of stone if he or he has contacted. First, an important aspect of the stone formation is the fluid intake, because the data has suggested that insufficient fluid consumption or excessive loss is one of the crucial risk factor for formation of stone. Optimizing fluid intake to achieve daily urine output of greater than or equal to 2 liters in all patients with chronic with the kidney stone formation. A high fluid intake has consistently shows that reduce formation of the stone disease in various studies. And these studies have also concluded that consumption of sugar, sweetened beverages should be avoided. The role of dietary calcium and stone in renal stone disease. Calcium supplementation is a protective factor against the stone formation, because calcium and oxalate bind together in the small intestine and excreted in the stool. Patient with a history of kidney stone formation may have abnormal intestinal calcium absorption, or either due to inherent predisposition or due to differences in the calcium intake. So there is a study that have shown that calcium consumed with the meals reduces the oxaluria, thus reducing the risk of formation of renal stones. Calcium supplements taken between the meals may increase the risk of stone, because about 8% of any extra dietary calcium passes in the urine, and taking the calcium supplementation at bedtime increases the calcinuria, but no effect on the oxaluria. Dietary oxalate and stone, renal stones, there is mainly two sources. There is a food or indigenous production in the liver. Foods which are rich in oxalates are chocolates, nuts, tea, soya protein, green leafy vegetables, and importantly potatoes. That is the main component of our kitchen diets. So dietary modification is required to reduce the dietary oxalate. It is recommended that up to 40 to 50 milligram per day oxalate should be taken. For a common man, 24-hour oxalate excretion should be known, and it should be told to the patient that calcium intake should be around 1000 milligram per day, because target of the 24-hour urinary oxalate excretion should be less than 0.5 milligram per kg per 24 hour. That is total approximately less than 45 milligram per 24 hour. What is the role of animal protein in formation of recurrent stones and how it affects? Because animal protein contains sulfur containing amino acids. These amino acids sulfur converted to the sulfates, and causing the increase pH, decrease the pH, leading to the acidosis. In the process of neutralization, calcium is excreted in the bone. From the bone, calcium is mobilized and excreted in the urine, causing calciuria. And animal protein also contains purines that is metabolized to the uric acid and causes the increased risk for uric acid stones. Both calcium hypercalciuria that may lead to binding of the oxalate in the urinary tract, and along with the uric acid that is nucleated in the kidney may cause increased risk of renal stones. A patient's a diet eliminating animal protein had a less than half the calcium loss that they had on their baseline diet. Even the modest increase in the animal protein from less than 50 gram to 77 grams per day was associated with 33% increased risk of stones in men and women. This has been shown in the study, and patients should be encouraged to plant source of protein. Now the role of salt in the recurrent renal stones. Ultra processed foods are more rich in sodium content, so it should be avoided because increased sodium may cause hypercalciuria, increase urinary pH, and decrease citric excretion. That may lead to increased risk of recurrent renal stone formation. When people cut their salt taken in half, they reduce their daily need for calcium because it may increase more in the urine. Calciuria increases nearly 40 milligram per 100 milliequivalent of supplemental sodium in normal adults diet and up to 80 milligram in patients with hypercalciuria and urinary stones. So, dietary advice is that those patients having recurrent renal stones should increase the plenty of any kind of plant-based diets, grains, vegetables, legumes, fruits containing almost no sodium in these sources. Dairy products and meats contain more salt than the plant products. Frozen meals, canned snacks also have very high content of sodium, so this should be discouraged. What is the role of sugars in forming the recurrent renal stones? National Health and Nutritional Examination Survey database has been suggested that this study has been done in USA between 2007 to 2018. They have recruited the patients age more than 20 years of age, and based on the survey with those patients having a history of renal stones, they found that compared with the less than 5% calorie from the added sugar population, the more than or equal to 25% calorie from the added sugar had a high risk of stone prevalence. In the Nurses Health Study, those who have consumed on an average 60 gram or more sugar per day had a 50% more risk for renal stone than those who consumed only about 20 gram per day. Because increased intake of the sugar may cause hypercalciuria, they promote the precipitation of the calcium and oxalate in the renal tubules. Calcium reduces urinary supersaturation of the calcium salts by forming soluble complexes with calcium ions, and important thing is that if those patients who have recurrent renal stones and having a low sodium citrate level in the urine may cause increased risk of precipitations. So, what are the recommendations to have to label any patients of renal stone disease to having hypocytopenia? This is a metabolic abnormality in some patients that the prevalence may have between 8% to 60% in some studies in stone former patients. Usually it is normal level is more than 2 milligram per kg per 24 hours. If it is less than 320 milligram per day, it is called as hypocytopenia. The vegetable usually the main source of citrate, and also the fruits, especially the citrate fruits contain much of the citrate. Beans and spinach also is a source of citrate, however they also contain oxalate. Should I take vegetarian diet or non-vegetarian diet? Can I eat meat? The patients who are affected with renal stone disease to be encouraged to take the vegetarian diet. General perception is that is the plant-based sources are the better, because it contain high in anion content citrate, potassium, malate, and it causes high urine pH. But high oxalate content is some concern, so avoid the abundance and monotony in our food content. Non-vegetarian diet, animal protein rich in purines, rich in calcium, salt content is also high, so allowed with some restrictions in recurrent stone formers and should be taken into wide intervals and avoid solid organ meat. There is a recently published CARI guidelines for the Australian and New Zealand. They have recommended that if any patients have first stone formation, the proper history and evaluation of those patients should be taken. If there is a possibility to take the stone analysis of these patients. And if they have again recurrent renal stones, 24-hour renal analysis should be done, and they have recommended those patients who have calcium based stone former, they optimize the fluid intake to maintain the urine volume equal to or more than 2.5 liter and limit the salt intake 2300 milligram per day. And those patients who are high risk for developing non-calcium renal stones, for example, uric acid containing renal stones, optimize the fluid intake, limit the salt, and for cystine stones, for increase the total urinary flow. So here is it recommended more than 3 liters per day of urine volume. So in the summary, avoid the generalization. All the patients with recurrent renal stones, individualize the approach with the patients depending upon the abnormality of those patients. If there is no identified cause there for the renal stones, recurrent renal stones, encourage them to eat more plant-based diets, fresh fruits and vegetables because they contain low oxalates. And reduce the ingestion, but it is limited intake of the animal protein and sugar should be avoided. Maintaining intake of 100 to 1200 milligram of calcium daily intake in those recurrent renal stone patients. Fluid restriction should be avoided, and main concern is that those patients who have renal dysfunction with the history of recurrent renal stones to be taken, the urine output should be generalized, that will be 2.5 liter per day urine output should be there. So restriction of the sodium is generalized less than 100 millimole per day. Thank you.
Very good presentation, Dr. Kushwaha. You have dealt with diet in a very comprehensive manner, but seldom we come across patients who want to get thoroughly evaluated. Not many would get evaluated for metabolic stone disorders. So if you give a blanket diet restriction, it reduces the nutritive value of food. So how would you treat a patient who is walking into your clinic, says, I have recurrent stones, but I cannot afford the metabolic stone evaluation? You don't know what type of stone former he is. So how would you approach that scenario?
Actually, the patients, sorry, can you repeat?
Should I repeat the question? Yeah. So not many patients would afford a metabolic stone evaluation, and not everybody would come up and say, I would get evaluated for the stone, type of stone that they have. So if somebody is a recurrent stone former, you don't know what composition of the stone they have, what would you advise them with regards to diet? Because if you avoid all the stone forming agents.
Most of them actually having the stone passes in the urine and go with the contact. I am not able to do the test for the 24-hour urine analysis. I am not able to take because of the some constraints. So these patients should be encouraged to take the at least 5 measures should be taken. The fluid intake, because it is the most important especially in our Indian continent, because urine output should be at least 2.5 liter per day. So much fluid to be taken, especially patients should be discouraged to take those beverages, especially sweetener added, Coca-Cola and other ultra-processed food beverages should be avoided. And second is important is restriction of the salt. It should be less than, preferably less than 2.3 gram per day sodium salt. And third is patients should be encouraged plant-based diet and reduce the intake of the proteins.
Thank you.
As calcium stone, calcioxalate stones are the most common stone all over the world, including India. How
Yeah.
about using thiazide diuretics to prevent hypercalciuria? Number two is that you have to maintain that fluid intake 24 hours, because at night you will go into severe supersaturation. So the fluid intake has to be round the clock to prevent stone formation, the fluid you said. And also, every stone patient should have a screening done for cystine, either a cystine. If cystine is positive, you can't quantify most of the places. If cystine is positive, there is a cystine stone there that should be taken into consideration.
Yes, rightly said, sir, because cystine patients with the cystine stones should have taken actually the cutoff value for total 24-hour urine in more than 3 liters. They have to, because the increased urine flow reduces the risk for cystine stone formation.